All right, everyone, take a breath because this chapter is all about you. Not the patient, not the call, not the patient's airway, but you. Chapter 2 is about workforce safety and wellness, okay? I'll be honest, if you skip this, none of the rest will matter, okay? I've known amazing EMTs and medics who could recite protocols from memory, but they burned out, got injured, or made one huge mistake in a high stress situation because they weren't taking care of themselves, okay? You are your own most important piece of equipment, okay? If you don't protect that equipment, your body, your mind, your emotional core, this career will chew you up. So in this chapter, we're going to talk about how to last, okay? How to stay strong, how to recover from the tough calls, and how to recognize the signs that you're spiraling before it's too late. Okay, this isn't fluff. It's really about survival. Okay, not survival of the patient, but survival of you. All right, we start with what the national standards tell us. They say that EMTs, as EMTs, we must apply our knowledge to provide care to acutely ill patients, and that sounds pretty straightforward, right? But here's the thing. How well you care for those patients directly correlates with how well you're caring for yourself. You can't think clearly, you can't perform a smooth patient assessment or make good decisions when you haven't slept in 2 days, or you're dragging through a shift on energy drinks and just rage. When your physical health is compromised, so is your clinical judgment, okay? So this chapter is about the opportunity to connect the dots between what happens in your body and mind and how well you perform out there on the call, okay? It's not theory, it's really, that's just experience, okay? Now let's get into the infectious diseases that we're going to talk about. You're going to spend your days in other people's homes, their cars, and their bodies, okay? You'll breathe the same air they do. You'll touch their skin. You'll handle their blood, their vomit, their saliva, and on some unfortunate occasions, their feces. It's not gross, it's just the job, okay? But it means you need to know how to protect yourself, okay? The rules for cleaning the ambulance, for disinfecting equipment, they're not just policies for OSHA compliance, they're really lifelines, okay? EMTs have been exposed, okay? Some have gotten sick, some have died, okay? This section is where you learn the tools to make sure you don't become one of them, okay? Don't gloss over any of this stuff, okay? Personal protective equipment is more than gloves and masks. It's really a mindset, okay? It's muscle memory. It's a culture of protection that starts really the moment you walk into the classroom, okay? And follows you into every call in your future. This part of the standards talks about preparatory knowledge, okay, and your understanding of EMS systems, of safety, of medical and legal responsibilities, and ethical behavior, okay. These are the guardrails of your practice, okay. So let me tell you, every EMT at some point ends up in a gray area where the protocol isn't clear. The patient's yelling at you, the family's panicking, and there's no time to open a book, okay? Your ability to stay grounded in your ethics, to remember what your scope is, what your job is, and what your responsibility starts and stops, that's what keeps you safe legally and more importantly, morally, okay? EMS is a human job, okay? And that means it comes with messy, real, complicated situation. This section is going to help us prepare for that. Here is where we really dig into the meat of the chapter. Standard safety precautions, personal protective equipment, stress management, lifting, scene hazards, disease transmission, grief, burnout. It's all in this chapter, okay? If it sounds like it's a lot, it's because it is, okay? Because the job is a lot. You're going to be exposed to scenes that are chaotic, heartbreaking, and sometimes dangerous, okay? There's no way to sugarcoat that, but what we can do is train for it, okay? Prepare for it. Know what we're walking into and how to walk out of it without carrying invisible wounds, okay? If you take nothing else from this chapter, just hear this. The best EMTs are the ones who know their limits, okay? Who take time off when they need it, who wear the right gear, okay? Get enough sleep, ask for help when they need it, and treat their body and brain with the same care they give their patients, okay? This chapter isn't just about surviving the shift, it's about surviving the entire career. So let's wrap up the list of competencies here. This last group might be the most personal. This is where we talk about the weight you carry, okay, literally and figuratively, okay? Lifting and moving patients without wrecking your back, okay? Protecting your mental health, dealing with death and dying, working a scene that might turn violent without warning, and recognizing that even routine calls can leave emotional marks, okay? These are not side notes in EMS. They're the daily realities, okay? And the truth is the impact of this job, it really builds up. One bad call might not break you, but 5 or 50, 100 without healthy habits, and that's where the damage will start, okay? This chapter is about preventing that. It's about being strong now and still being strong 10 years from now. And if you want a long career in this field, a good career, you have to take this seriously. So, with that being said, let's start with the big idea, okay? You cannot care for others if you're falling apart yourself, okay? And it's not just about physical, okay? I'm talking about sleep deprivation, toxic stress, emotional burnout, compassion fatigue, all of it. Every single EMT will face these threats, and it's not an if, okay? It's a guarantee. This chapter opens with the truth that EMS carries a higher risk than most professions. You'll be stretched mentally, okay? You'll be exposed to trauma. You'll even be injured or threatened. It's not really a scare tactic. It's just the reality of the profession you're getting into. But there's good news. We now understand more about how those threats work and how to protect ourselves, okay? That means we can prepare, okay? We can train not just our hands, but our minds, our hearts to handle this job, and hopefully walk away from it healthy, or at least relatively healthy. So don't gloss over this chapter. The tools here, you just have to use them, okay? And embrace them. When people hear the word health, okay, most immediately think of illness, injury, but we're way past that now. Health isn't just whether you're sick or not. It's your whole system, physical, mental, emotional. If one area is off, it drags the others with it. Just think about it. A bad night of sleep, okay, it messes with your mood. Okay? Chronic stress can give you chest pain. Anxiety can leave you feeling exhausted. On the flip side, when you're eating right, you're moving your body, you're staying connected with the people who support you, your system, your whole body system runs better, okay? You're able to bounce back. You think more clearly. You treat patients more compassionately. EMS just isn't about knowing protocols. It's about being able to perform them under pressure, okay? And you can't do that if you're running on fumes. That's what this slide is reminding us, okay? Your mind, your body, and your emotions are all part of your equipment. So you just need to keep them tuned and ready, okay? This slide is a game changer because it makes a critical distinction, okay? Not all stress is bad. Some stress is actually helpful, okay? There's a name for that. It's called eustress, okay? That's the stress that kicks in during a hot call, the adrenaline that sharpens your focus, makes your movements precise, it fuels your confidence, okay? It's why so many people thrive in high-intensity situations. It's really what makes you feel alive during a tough call. But then there's distress, right? That's the kind that creeps in after a series of hard nights, or after a failed resuscitation, or after your third combative psych patient in one shift. The stress doesn't energize you, okay? It wears you down. It clouds your thinking. It steals your sleep and your patience and your compassion, okay? The difference between the two isn't just the call, it's in how you handle it afterwards, okay? The key isn't to avoid all stress, it's to manage the bad kind and cultivate the good. And that's what we're going to talk about, okay? Wellness, right? So wellness doesn't happen by accident. It's not something you're born with or something you can get lucky enough to keep. It's something you really have to work on. In an EMS where chaos is just a norm part of the job, wellness has to be something you chase on purpose, right? That means that eating food that actually fuels you, not just grabbing gas station snacks, coffee, energy drinks. It means getting real sleep, not just crashing on the couch between shifts. It means exercising even when you're tired, because being strong and mobile keeps you from getting injured, okay? But it's not just physical, it's relationships, it's mindfulness, positivity. not just like your fake smiles. It's real, intentional gratitude and perspective. Okay, this slide is like your blueprint in reminding you that resilience, the ability to simply bounce back from stress, isn't just a personality trait. It's a habit. It's built, right? It's not born. You want to last in this job, and this is exactly how. Okay. So let's keep building on that picture of what wellness really looks like, okay? It's not just sleep, eating salad. It's really the connections, okay? The relationships you build with your peers, your colleagues, aren't just nice to haves, like they're really the lifeline, okay? You'll see things in this job that people on the outside can't even imagine, okay? Having someone you trust, someone who's been there, who gets it, that's what keeps you grounded, okay? And you don't have to wait for a traumatic call to build those relationships. I mean, it starts in the downtime, right? On the drive back to station, in the at the coffee shop, you need people in your corner, and alongside those relationships, you need movement. You don't have to be a gym rat, but stretch, move your body, keep it functional. You'd be surprised how much stress gets trapped in your muscles, right? If you want to start rewiring your stress response, start practicing mindfulness. And no, that doesn't mean you're sitting cross-legged and doing yoga and humming, but it really just means being present, right? It means noticing your own body, your own thoughts, without judging, like judging yourself. It means like pausing, even for like 10 seconds. Take a breath. Walking into a cuff call, just take a deep breath. These small little daily things will add up, and the sooner you make them a habit, the better you'll hold up overall in the long term. So let's talk about stress itself. Okay, real, right? Daily, it's going to knock the wind out of you, kind of stress. I'm sure some of you have it. I know I got it. And what do you do with it, right? The first strategy is always to do this, is to try to minimize it, like where you can. If a certain shift partner is dragging you down with negativity or hostility, see if you can switch shifts. If your schedule is unsustainable, if the calls are bleeding into your sleep, your meals, your family time, talk to your supervisor about rotating stations or adjusting your hours. Change what you can, okay? If you can't change the external situation, then we shift to the internal. Start by changing your environment. If your station is chaos, find 5 minutes of peace, right? A walk around the building, a quiet corner. Cut back on overtime. That's a big one. I know that's easier said than done, especially if you're trying to, you're stack your hours, but you can't help others if you're physically just unraveling. The job does demand a lot from you, okay? You have to demand sustainability from it in return, though. Now, if we go deeper, what happens when the stressor is still there and it's just not going away anytime soon, right? You have to change how you relate to it, okay? Start by talking, seriously, like just talk to someone, your partner, your spouse, a friend, even a therapist, right? If it's bigger than what you can carry alone, just like don't bottle it up. Don't pretend you're fine. That's how people will explode. Okay, right? Not in a movie scene breakdown, but in a quiet burnout that eats away at you over time. Talk about your feelings, get perspective, and stop obsessing over the little things that you can't fix, right? The frequent flyers, right? The overdoses, the losses. Those are just parts of the job, okay? But they don't have to consume you, right? Let them go. Adopt a more philosophical outlook. Learn to say, hey, that's out of my hands, but I showed up, I did my part. That's the kind of mindset that it doesn't mean you care less. It means you're learning to carry the weight without it simply like crushing you. Okay. Here's where you can expand your support system, right? Make friends who aren't EMTs, right? Who aren't paramedics, who aren't nurses, right? Build a life that's more than your uniform. When your whole identity is tied to being a responder, the job just has too much power over your self-worth, okay? Get hobbies, take up hiking, music, build stuff. Anything that reminds you of like who you are when you're not saving lives, right? And yes, yeah, we're going in there. Cut down on the caffeine, the alcohol, the tobacco. They're not evil, right? But they're not helping. Okay, caffeine specifically is going to be a big hindrance in your overall stress, especially as an EMT and paramedic. But it really spikes your stress response. Okay. Alcohol numbs it temporarily and comes back with a vengeance, right? Tobacco, well, your lungs don't need the irony, smoking while being a medical provider, but you want a real stress relief. Again, stretch, breathe deep, go for a walk, work out, sit in the sun, anything. Call someone, call somebody. None of it's like groundbreaking or flashy. It's just it takes work and a conscious effort. Okay. Most importantly, just do it often. Consistency. Okay. That's what's really going to rewire your baseline. That's how you go from survival mode to actually living well in this job. Nutrition. So your fuel, right? Nutrition isn't just about your weight, right? It's about performance. Your brain, your body, your reflexes, all of them really depend on what you put in your mouth. Okay. Now I know what EMS food culture looks like. It's energy drinks, stopping at the gas station, Del Taco, pizza in the 2 a.m. I get it. And you're going to understand that too. But the truth is, when your body's constantly playing catch up on real nutrients, you're going to be slower. You're foggier. You're more prone to getting sick. You need high quality, sustained energy. That means complex carbs like rice, whole grains, vegetables. Not these high fructose, high sugar, just bombs that are going to spike and crash. Proteins, healthy fats, lots of water. Okay, lots and lots of water. But throughout the entire day, obviously, carry your own snacks. Pack your lunches, because again, with this job, you don't always have set break times to actually go get a healthy meal. So have your own snacks: banana, protein bar, trail mix. Eat small, consistent meals. Better than starving than overeating. Limit alcohol, sodium, grease. All those things will add up. So if you really think of it, think of nutrition as another form of PPE, your personal protective equipment. It's not just protection; it's preparation. You don't wait until you're in a fire to put on your gear, right? You don't wait until your body breaks down to start actually feeling right. Okay. Exercise, right? Again, it's not just about your muscles and what do you look like in your uniform. It's about whether or not you can carry someone down a flight of stairs. Can you perform CPR for 30 minutes without gassing out, or sprint 100 feet to grab gear because the scene turned chaotic? You shouldn't really sprint on scene, but it's fine. This is really about being physically prepared to do what the job demands, right? Just simply like 30 minutes of movement of a day, 5 days per week. It's not going to the gym, not having a full-on routine. I mean, that'll be beneficial, but again, you're just trying to survive and survive in this job. You're just investing in your knees, like in your back, your grip strength. It's not just about strength either. It's stress relief. Okay, when you move your body, you move your mind. You release endorphins. You shake off the static. You quiet the noise in your own head. If you ever got into a call, feeling tight, anxious, wound up, you know how badly we need that. So make it part of your lifestyle. Okay. It doesn't have to be perfect, doesn't have to be pretty, just move. Walk the station, do some push-ups, stretch after the shift. Your body will thank you, and it'll pay dividends. Your patience will benefit, and your mind will just get a little quieter, okay? Just a little quieter. This is sleep. So sleep is where most EMTs fail themselves, okay? And it's not their fault. Because between 24-hour shifts, back-to-back calls, overtime, mandatory overtime, poor schedules, sleep is often a luxury. Okay, but the truth is, when you're running on 4 hours of sleep, you're basically working intoxicated. Your decision making slows down. Your emotional regulation it just crumbles. Okay. reaction time, it tanks. And this is the job that is just not an inconvenience, it's a liability. Okay, half of EMS personnel are chronically sleep deprived. That's not a stat, it's a crisis. Okay, the more we ignore it, the worse the consequences. Fatigue-related crashes, medical errors, burnout, long-term damage like depression, high blood pressure, immune dysfunction. Sleep really isn't optional; it's foundational. So don't wear your exhaustion like a badge of honor. Like, fix it, prioritize it, protect it like it's your own life, and your patients, because it does depend on it. Because it does, right? So where can you get sleep, right? How can we actually combat the fatigue? So first, you got to get enough of it, right? Typically 7 to 9 hours a night is kind of where you want to be, not 7 to 9 hours a week, okay? If your shift allows it, build in time for short naps, right? Whenever you get a chance, whenever there is downtime, take a nap. 20 to 30 minutes solid nap during a lull in your shift. It can really reset your brain and give you hours of clarity and control. And when you're awake, keep your body moving, stretch, again, walk, get the blood flowing. But also be careful, because be careful with the caffeine, okay? It's supposed to be a tool, not a lifestyle, okay? A cup, like an energy drink at the right time, helpful. 5 energy drinks at 2 a.m., this is probably a heart attack waiting to happen. But caffeine really tricks your body into feeling energized, but it robs you of your quality sleep later on. It jacks up your anxiety. Treat it with respect, and when you start to feel your brain fog over or your mood snaps sideways, that's like your body saying, hey, I need to rest. So you really need to listen to it and not rely so much on the caffeine, okay? You're also gonna have to train your body to sleep well, not just long. Start with your environment, make it dark, make it cool, make it quiet. If you live near a busy road, so this is like when you're like off work, or have kids or roommates, get blackout curtains, white noise machines, earplugs if you really need to, really whatever it takes. Like, don't sabotage your sleep before it even starts. That means, again, no caffeine, no nicotine for at least 4 hours before bed. Don't eat a huge meal and then try to crash. Don't drink a gallon of water and wonder why you're getting up at 3 in the morning to relieve yourself. Give your body time to really wind down. Maybe that means reading, taking a shower, stretching, whatever works for you. But don't fight the sleep. Don't lay in bed scrolling on your phone, watching the clock, getting mad at yourself for being awake. Just get up, reset, come back when your brain is ready, and as much as possible, go to bed and wake up at the same time every day, even on your off days. Okay, it's all about consistency. Your body, when it's safe to drop into the deep sleep, it's going to be restorative sleep, and that's what your body and your mind really needs. And there's one last critical piece, natural light, okay? It might sound small, but your body depends on light to see its internal clock, okay? What we call the circadian rhythm, okay? When you wake up, step outside. Get some sun on your skin, even for just a few minutes. It signals to your brain that it's daytime, right? It's time to be awake. That's gonna help anchor your whole sleep cycle, especially if you're working nights, okay? This becomes even more important. Again, use blackout curtains to sleep. Then when you wake up, open them up, let the light in. Your brain doesn't care what the clock says, it cares what your eyes see, okay? Your biology is built on rhythm, and if you honor that rhythm, you'll sleep better, okay? You'll perform better, and you'll feel more like a human being rather than a zombie in a uniform. So again, sleep isn't just rest, it's about recovery. And in EMS, you're going to need it every single day. When we talk about staying healthy, okay, in this profession, it's really not just about dodging injury or managing stress. It's also about avoiding the things that will quietly wear you down over time, okay? This is where we shift into disease prevention and health promotion. Now, those might sound like vague, little buzzwords, but they're actually two very different essential ideas. So disease prevention, okay, that's medical, okay? It's getting vaccinated, doing your annual screenings, wearing your PPE. It's about not getting sick. Where health promotion, though, is personal. It's the habits you build, it's what you eat, how you sleep, how you move, really how you manage your emotions. And while disease prevention helps you avoid, getting knocked out of work, health promotion helps you thrive while you're in work. Okay, you're not just trying to not get sick. You're trying to stay clear-headed and functional under pressure. That's what this section is about. It's about learning the difference and building both in your life before the job starts taking more than it actually gives. Tobacco, right? So if we're talking about tobacco, we can be honest about it. If you don't use it, I would not recommend it, right? If you do, it's time to have a serious talk with yourself. Smoking, chewing, vaping, they're all at the heart. They're all just poison, okay? And not just for your lungs. It's like these habits raise your risk for heart attack, right? For stroke, cancer. The same things we really treat in our own patients, right? Sorry, I'm just trying to adjust this. The double standard, it's wild, right? We can tell people, hey, you need to quit, but you ignore that advice yourselves. And I get it, quitting is hard. That's why it helps to have a plan, set a quit date, get support, remove triggers from your environment. You can talk to your doctor, your partner, your crew. Really, your life is worth the effort, okay? And also, for the record, vaping is not healthy. It's not a healthy alternative, okay? It's just a different road to the same destination. That's going to be lung injury, inflammation, long-term damage that are still on the table, okay? So if you want to keep working, breathing, thinking clearly, really the tobacco has to stop, okay? Now, heading into the alcohol conversation. I want to be real with you as well. Alcohol is deeply embedded in EMS culture. Like, you get off a rough shift, someone says, hey, let's grab a drink, and then suddenly that becomes the norm. And while there's nothing wrong with the occasional drink, you need to know where the line is. Like, the CDC defines heavy drinking and binge drinking very clearly, and most of the time we blow way past those limits without thinking twice. Okay, long-term cost, liver damage, right? Immune suppression, emotional instability, increased risk of depression, anxiety, all of which we already battle in this line of work. And here's the thing, even if you're not drinking daily, if you're using alcohol as a coping mechanism, that's walking a dangerous line. You need to find another outlet, something that helps you process the stress without punishing your body for it. I've seen too many good medics, too many good EMTs like spiral down into the bottle and not come back up. So it's not weakness to talk about it, it's strength, okay? Finally, let's talk about drugs, okay? So whether it's legal, illegal, because they both matter here. If you're using illicit drugs or misusing prescriptions, I don't care how functional you feel, you're a danger to your patient and yourself. If you're taking medications that affects your cognition or your coordination, even with a prescription, you need to talk to your supervisor, right? EMS agencies drug test for a reason. This job requires split-second decisions, like physical stability, absolute presence of mind. Anything that messes with that puts lives at risk. So I'm not saying don't take your medication. I'm saying how it affects you, know how it affects you, and never lie about it, okay? It's not just about policy, it's about safety, it's about trust. And the consequences, legal, professional, personal, they're just too great to ignore. So take care of your body, be honest about what you put in it, and then when in doubt, talk to someone who can help you make the right call about it. Balancing work, family, and health. Okay, so this one sneaks up on you. You come into EMS with passion, right, with purpose, and it starts to become your entire identity. The job just pulls you in, and before you know it, you're working every shift you can grab. You're sleeping at the station, you're skipping meals with family, and ghosting your friends because you're just too tired after your shift. And sometimes that's just the reality of the schedule. But over time, if you don't fight to protect your life outside of work, the job will just consume you. Okay, you'll start missing birthdays, you'll start feeling disconnected, you'll feel like a stranger really in your own house. And that's not the cost of commitment, right? That's burnout in slow motion, okay? You need to rotate your schedule, take time off, use your vacation days, and spend real uninterrupted time with the people who matter most to you, okay? They're the ones who are going to help you recover from that call that breaks your heart, right? And they can't do that if you shut them out, okay? So this job will take everything if you give it, all right? So make sure you're keeping something for yourself. So infectious and communicable diseases. So this might feel less emotional, okay? But it's just as critical, okay? Infectious disease, okay? When we say infectious disease, we're talking about something caused by a harmful organism growing inside the body. Think bacteria, fungi, parasites. So, but when we say communicable disease, we're getting specific, okay? It's something that can spread from one person to another, from an animal to human, and unfortunately, here's the deal, in the EMS, you're going to encounter both, okay? When you walk into rooms where someone is coughing with active tuberculosis, you're gonna walk in the room with them, okay? And that means you are gonna be potentially exposed, okay? You're gonna treat people with HIV, with hepatitis, meningitis, flu, COVID, and you often won't have any idea, okay? You can't always tell by looking at someone whether they're carrying a communicable disease. That's why precautions can't be based on simple appearance or diagnosis, right? Every single patient must be treated as potentially infectious, okay? It's not paranoia, it's just professional protection, okay? Now, let's talk about how it affects you, right? Exposure doesn't mean infection, okay? You might come into contact with blood or droplets or tissues or whatnot, but whether or not you get sick depends on the type and the amount of organism, your body's resistance, your vaccination status, and let's be honest, whether you were wearing the gear the right way. Terms like pathogen, contamination, exposure, they're not just vocabulary words, medical terms, they're critical concepts, okay? A pathogen is the invader, okay? Contamination is how it gets on you, and exposure is how it gets in you, okay? And every step in that chain is a chance for you to intervene, right? Personal protective equipment, your PPE, is the barrier between you and that chain of transmission. Gloves, masks, gowns, face shields, they're really not suggestions, okay? They're your shields or protection. And you don't put on your armor halfway through the battle. It needs to be on before you're exposed, okay? And taken off properly afterwards. So we're going to walk through exactly how to do that in the next few slides, and then obviously in lab. But it starts here, okay? So no matter the patient, you need to protect yourself like they have something contagious, okay? Because one day, inevitably, they will have something contagious. So let's break down how this stuff, actually spreads, okay? There are 5 main ways you can get infected on this job, okay? Direct contact, indirect contact, airborne, foodborne, and vectorborne, okay? Direct contact is the simplest, as one person's bodily fluid touches your skin or enters your bloodstream, okay? Indirect contact is a little sneakier. That's when a germ hops onto an object, like your stretcher, doorknob, blood pressure cuff, and then onto you. Airborne transmission, that's the big one, okay? That's why we wear our N95 mask. That's when you have tiny droplets hang in the air after someone coughs or sneezes, and you don't even have to be standing right next to them, and you just breathe them in, okay? Foodborne transmission or diseases are a little bit less common in EMS, but again, they still matter, especially if your station hygiene is lacking. And then we have vector-borne illnesses like think fleas, ticks, mosquitoes. These ones are kind of rare on the job for your own protection, but it's not impossible, okay? Overall, the key takeaway is like every call is a potential for an exposure event, okay? So if you understand the routes of transmission, you understand how to block them, and that's what we're doing next, okay? So how do we reduce the risk, right? So it starts with our standard precautions, okay? These were created by the CDC, so Center for Disease Control, enforced by OSHA, and they're based on one simple fact, okay? You can't tell who's infected just by looking, okay? So you assume everyone is. You wash your hands before and after every patient contact. You wear gloves even if there's even a chance of contact with blood or fluids. You don't recap needles, okay? You put your sharps in a proper container. You wear eye protection if anything's going to spray or splash. Is the patient coughing? You mask them, right? If they might have TB or COVID, you're going to wear your own N95 mask. If you think, I'll just skip the gown this time, it's probably nothing. Remember, that's what the last EMT thought, right? Before they got exposed. So these precautions aren't optional, okay? They're your seatbelt, your helmet, your bulletproof vest. Follow them like your life depends on it, because sometimes it actually does, okay? So safety is always going to be your priority. So let's talk about donning and doffing PPE. So donning means putting on, doffing means to take it off, okay? You need to actually use your PPE, right? Because it's not just about wearing gloves and a mask. It's about putting them on and taking them off the right way, okay? Donning starts with the gown. You tie it at the back, snug but not choking you. Then your mask, N95, airborne precautions are needed. You do a seal check on it. Don't slap it on. When you're wearing eye protection, or wraparound goggles or a face shield. Finally, gloves, pulled over the sleeves. That's order of operation matters, right? And it really depends on the type of PPE you're going to be wearing. When it's time to take it off, you do it slowly, right? Gloves come off first. You don't snap them or fling them. Then eye protection, tilt your head back down, lift from the back. Again, we're going to cover a lot of this in our lab. And then you take off the gown, right? And the N95 mask is going to come off last, because if the air around you is contaminated, you don't want to be unmasked for a second longer than you have to be, okay? The golden rule is after you're done, you wash, right? Always soap, water, scrub. PPE doesn't do its job if you don't respect the sequence, okay? So memorize it, make it second nature. You won't have time to Google this kind of stuff and research it when you're covered in bodily fluids. So always remember and respect the PPE and the process for putting it on and taking it off. So let's talk about the proper hand hygiene. So let's talk about the simplest, most effective, and most really ignored tool in disease prevention, and that's going to be simply washing your hands, okay? It doesn't sound glamorous, right? But it's absolutely essential, okay? You should wash before and after every patient contact, even if you wore gloves. Now, in the field, it's not possible really to wash before you touch a patient, but you should afterwards when you get to the hospital, okay? Gloves themselves are not magic, force fields. They're porous. They rip. They fail. Germs love your hands, especially under your fingernails. So between your fingers, on the back of your knuckles, if you're rubbing your eyes, adjusting your mask, touching your face, checking your phone, everything becomes contaminated. So you've just given pathogens, a free ride into your body. So you got to make sure that you're doing proper hand hygiene and sanitation and disinfecting protocols for all your equipment. But again, we're just talking about hands right now. So your hands, it's washing your hands isn't just a courtesy to others, really. It's like a barrier, right? It's you're drawing a line between the patient and your own bloodstream. Okay, that's what your hands are, and that's the line that needs to be respected every single shift. So again, wash your hands after every single patient contact. Now, in terms of the technique, real hand washing. Not a 3-second, quick little scrub. It's you want to scrub your hands for at least 20 seconds. Okay, you want to use warm waters. You want to use soap. Focus on the area people typically skip, like underneath your nails, between your fingers, back of your hands. You want to rinse well, dry with a paper towel, not your uniform, not your jeans, and use that same paper towel to turn off the faucet, right? So because again, that's contaminated. If there's no running water, then yeah, you can use hand sanitizer, very common in the pre-hospital setting. But that's not a backup plan. It's not a replacement. Okay, it's the moment you can't get to soap and water. Okay, so as soon as you can get to soap and water, wash your hands. And it's really not just about protecting you, it's about protecting the next patient, because if you don't wash up properly, the next person you treat might be getting more than just your medical care, and they might be getting someone else's infection, okay? So now that you're a professional, so treat your hands like the tools that they really are. Let's move on to gloves, okay? Gloves are the most common piece of personal protective equipment. You'll use, and the biggest mistake people make is treating them like invisibility cloaks or whatnot. They're not. Gloves don't replace hand hygiene. They're really just a temporary barrier, and they only work if you're using the right kind at the right time, okay? So nitrile, vinyl, latex, each has strengths and weaknesses. Some are better for blood and fluid exposures, some for quick contact tasks, and if you or your patient has a latex allergy, that's a serious problem, right? So typically in the medical field, we'll use like nitrile, which is like a synthetic material, or like a vinyl. It really, here's what you have to remember, like gloves need to be changed between patients, okay? Or when they become saturated with a hazardous material, okay? That includes, scene work, hospital transfers, loading stretchers. Anytime your hands move from person to person or place to another, your gloves need to be changed, okay? Because what you're going to have is called cross-contamination, okay? It's real, and it's often your hands that are the vehicle, unfortunately. Now, how do you remove gloves, right? Because this is where most people mess up, okay? So you can wear gloves all day and still get exposed if you take them off improperly. So you're gonna really, and we're gonna cover this in lap, but you start by pinching the outside of one glove and the wrist to peel it away from the hand, okay? You're gonna turn it inside out. So it's boom, boom, and we're gonna cover this in lap. But both gloves come off inside out with the contaminated surfaces tucked away. Okay? Then you're going to toss them immediately into a proper biohazard container. Never reuse gloves, never touch clean gear or your face while wearing them. And for cleaning the rig or handling heavily soiled equipment, you really want to use heavy-duty utility gloves, not your patient care gloves. Because if you wouldn't touch it before, bare hand, don't touch it, with thin gloves either. Treat gloves like a single-use syringe. Once they're used, you just dispose of them. And that's how you're going to keep yourself and your patients safe. So now moving on to eye protection and face shields. So really your eyes are an open door, okay? And in trauma, airway management, childbirth, even just a sneeze, that door can become an access point for infectious droplets in an instant. Blood, saliva, vomit, all of it can arc right into your face, okay? Prescription glasses, they don't count. They make it, they might make you see better, but you really don't, it doesn't protect your sides, right? Your angles, or your eyes from airborne particles, okay? What you need are goggles with side shields or a full-on face shield. And I know they do fog up. They're going to feel awkward, but you'd rather wear goggles or get hepatitis sprayed into your cornea, right? So it's really about risk management. You don't get a second chance with exposure. Once it's in your eye, it's in your system. So always wear eye protection when the call suggests it. And if it's an aerosol generating pathogen and whatnot, you double down. Shield, mask, gloves, the gown. You got to treat your eyes as if they're sacred, right? Protect them like you plan to use them for the rest of your life, right? Gowns, okay? They're going to be calls when gloves and eye protection just aren't enough. You're going to know it in the moment you step into the room. There's a field delivery, so you're about to deliver a baby or trauma with an arterial bleed. Maybe you're just suctioning a patient with a heavy vomiting and respiratory failure, right? It's not the time to roll the dice on contamination. It's time to gown up, right? And I tell you right now, most people wait too long to throw one on, okay? They think it'll be fine. I'll just stay out of the splash zone, so to speak. But EMS doesn't do predictable. That's not how blood and secretions work. A gown is there to protect everything your gloves and goggles can't, right? Your chest, your arms, your uniform. You might be kneeling, leaning, catching a flailing arm mid-intubation. And without that gown, you're gonna walk. You're walking out soaked and wondering what you were just exposed to. Okay, so be proactive. Know your protocols. If there's any chance things are going to get messy, and to be honest, they're almost always gonna get messy. Just don the gown. Okay, don't let the ego or the inconvenience get into the way of your safety. Now let's talk about masks, respirators, and barrier devices, okay? This is gonna impact how we breathe, okay? And we wanna protect that. What should we not be breathing in? Respiratory precautions, a huge part of protecting ourselves in the field. And really, not all masks are created equal, okay? If you're worried about fluids splatter like blood, vomit, or sputum, a surgical mask is what you need, okay? It's really just a physical barrier. It works just fine. But when you're worried about particles like hanging in the air, like tuberculosis, flu, or COVID, that's when you need your HEPA mask, your N95 mask. Not because it looks more official, but because it seals your face and it really filters the air, okay? And listen to that seal because it matters, okay? Facial hair will break it, so that's one of the reasons why we mandate that you have to be clean shaven. You can have a mustache and that's it. A crooked strap can break the seal. You can't slap one on and call it good, okay? It has to be fit right. So you're gonna get fit tested when you actually get hired on. And it's not just about you, it's about controlling the spread of this disease. So if the patient's coughing, they get a mask first, and then their mask is gonna be a surgical mask, okay? But every breath they exhale after that after you put on that mask goes on is gonna be filtered, right? And that's gonna help everyone from being less exposed, okay? It's really a two-way street, okay? You protect yourself and you protect the next responder, okay? The next patient and really the family waiting at the door, okay? So you definitely want to wear the respiratory protection when it's necessary, or indicated rather. Now, let's say the worst happens, a patient codes, right? That means their heart stops working, they stop breathing. You need to ventilate, right? You need to act fast, but you also need to stay safe, okay? This is where little barrier devices can save lives, and including yours, protect it, right? You never want to go mouth to mouth, okay? So your mouth should never touch another person's mouth in the medical field. You never drop your own mask and lean in. You use what we call a pocket mask with a one-way valve, or ideally a bag valve mask, okay, with a HEPA filter, okay? And we'll cover that later on. Even in the chaos, especially in the chaos, you need to protect yourself, okay? And here's where people really forget, okay? Once that mask, that device, that plastic airway adjunct touches the patient's face or the lips or the breath, it becomes contaminated. It's not probably fine, it's most definitely dirty, okay? So treat it like that, clean it or dispose of it, really no exceptions, okay? These aren't backup tools, okay? They're frontline tools that bridge the gap between infection prevention and critical care, okay? You need to know them, trust them, and use them just like as if it was second nature. Now, proper disposal of sharps. Now, as an EMT, you're not really going to be handling sharps too often, but there are times, okay? Sharps themselves, especially in the medical field, deceptive, okay? They're tiny, they're routine, and they're one of the most dangerous things we touch, okay? One slip, one lapse of judgment, I'll just recap this thing real quick, and you're facing a possible exposure to HIV, it's hepatitis B, hepatitis C. So the rule is there are no exceptions, right? Don't recap needles, don't bend the needles, don't snap needles, don't use it, drop it. It goes right into the container, okay? You use it, you drop it into the container. And that container, it needs to be close, right? Not in the back of the rig, not where you have to like walk and find it, not you have to dig through stuff. It should be right visible, mounted, and within reach after using your the needle or any of your sharps. The longer the sharp actually stays in your hand, the higher the risk is, right? So I don't care how experienced you become, how calm the seam feels. You're just one distraction away from just a life-changing injury. So handle every needle, every lancet, every scalpel, if you're like doing that, as if it's like a loaded weapon, okay? Because really it is, okay? So do proper disposable. Now responsibility. Now specifically the employer responsibility. As much as you are responsible for your own safety, your employer carries weight here too, okay? It's their legal duty to provide a safe work environment. Now, that means they supply you your PPE, okay? They write your infection control plan. They train you, not once, not halfway, but thoroughly, consistently, legally, okay? And if that's not happening, if gloves are locked in a closet or gowns are on back order for weeks, that's just not, it's not just annoying, but it's really a violation, okay? You have the right to say something, right? More than that, you should say something, because silence doesn't prevent exposures. And the next person who suffers from the lack of supplies might be you. So this isn't about being a whistleblower. It's about making sure we all walk away from our shifts as healthy as we came in. So safety is not just a favor, right? The employer is going to offer. It's a policy, and it's enforceable. Okay. Now they can't guarantee you a 100% risk-free environment. It's just not the name of the game. But again, they should provide you with those personal protective pieces of equipment. So in establishing an infectious control routine. All right. So let's. One thing needs to be clear. Infection control is not a box to check, okay? It's a routine, okay? It's a mindset that kicks in before the call even begins. It starts when you hear the dispatch. You think, what might I be walking into, okay? That's when you start gearing up. Not when you're already inside the house staring at the patient, okay? You've got to have your PPE out, ready before your boots hit that sidewalk. And when you walk in, your eyes are scanning, okay? You're looking for blood, vomit, any respiratory symptoms, anything that might indicate the need for gloves, gown, mask, eyewear, okay? Then it's not just about protecting ourselves. It's about limiting how many hands are on the patient. If there's blood everywhere, one person manages the airway, one controls the bleeding, not 5 people crowding in and tracking biohazards all over the place. When the call is over, it's gloves off, hands washed, gear and equipment disinfected. And if something does go wrong, if you're exposed, you don't brush it off, okay? You need to report it immediately, because infection control isn't just a moment, it's a rhythm, okay? And once you find that rhythm, it becomes second nature, and that's what we're striving for. Immunity. Okay, so now you're exposed. Now what? Well, maybe nothing, because your body is smarter than you think. Immunity is your internal defense system, so to speak. Sometimes it's built in. Sometimes it comes from surviving a previous infection. And sometimes, most of the time in the EMS, it comes from vaccines, okay? The stronger your immune system, the less likely you are to get sick after an exposure, okay? So think of it like this. Exposure is a gamble, right? Immunity stacks the deck in your favor, but here's the catch. Immunity isn't a guarantee. It's a layer of defense. So when someone tells you they've already had COVID or got their shots back in high school, that's not a free pass, right? Immunity can fade, it can fail. Different pathogens affect different people in different ways. So protect your immunity system with sleep, proper nutrition and hydration, but don't let it replace your PPE, okay? Use both, right? Think of your PPE and your immunity as external and internal armor, right? You need both really to stay on the field. Once again, immunizations, they're not just something we ask of our patients. There's something we need to stay in the game, and not just flu shots. We're talking hepatitis B, your MMR, Tdap, varicella, the full slate, okay? If you've been through EMT onboarding, which you guys are in the process of at least going through for the program, you're going to sign a waiver for at least one of these. But the waiver doesn't protect you, okay? That signature means you acknowledge the risk and chose to proceed without the protection. So that's going to be more with the flu shot and the COVID vaccine, okay? And that's fine if you know what you're doing, okay? But most don't, unfortunately. If you haven't been vaccinated or if you're not sure, just check. Don't assume. If your agency that you're going to go into offers vaccination, specifically hepatitis B, I always recommend taking it. But again, you're an adult, you're your own person. It is required by OSHA for a reason to be vaccinated. So again, we're going to be around blood, sputum. We're really around people who sometimes don't even know that they're carrying. So you have the ability to protect yourselves from diseases that can change or really end your life. Okay, so you need to take that seriously. It's not just your health, it's the health of your family, your coworkers, and really every single patient that you're going to end up treating. All right. So general post-exposure management. So this is like if you get exposed. If you get exposed, what do you do next? Okay. So this is the worst case scenario. Okay. Right. You got exposed, right? It happens. You weren't careful, but you were careful, excuse me, but the patient vomited unexpectedly, or, you got stuck with a needle by the paramedic on accident. Or maybe you're just helping with an airway and the mask wasn't tight enough. Now what? Step one, you need to stop, okay? Hand off the patient care. Get to a safe place, clean the area immediately, soap and water if it's on your skin, flush your eyes if that's where it hit. Step two, you need to report it, okay? Don't care if it was just a splash, probably nothing. You need to report it. Your department has a specific protocol for these specific exposures. So it starts with contacting the infection control officer or maybe your immediate supervisor. You want to document it, right? When did it happen? What were you wearing? What were you doing? What did you do afterwards? That report isn't just paperwork. It's going to be your follow-up, right? It's going to be what do you do next for post-exposure prophylaxis, so like your treatment, right? For legal protections, right? If anything escalates. So really don't downplay it, don't brush it off, and definitely don't wait. Every minute matters when you're getting exposed, not just for treatment, but for just your own peace of mind, because you're going to freak out. I've had plenty of exposures in my lifetime. Nothing stuck though, so we're good. Now, scene safety, okay? Before we even step out of the rig, okay, you're doing your first scene size up. Not when you get to the patient, not when you're halfway to the door, but it's really before you even open up that door, maybe even while you're driving, maybe when you first got in shift that morning. So what do you see, right? What did dispatch say? Are there hazards, right? Traffic, is there any unstable structures, any agitated people around? Is this the kind of scene where you should wait for law enforcement or hazmat, for fire, for law enforcement? So scene safety isn't something you do just once, right? It's an ongoing process, because in an emergency environment, conditions change. It's very dynamic. What's safe 1 minute could be dangerous the next. Maybe a fight breaks out, or a car backfires, a patient becomes violent. So your job isn't just to render care, your job is to make it home, okay? That means seatbelts on during transport. That means wearing reflective gear at night. That means parking the rig in a way that protects your scene, but doesn't block your escape, right? You're not good to anyone if you get hurt, okay? So safety is not selfish, okay? It's your responsibility, right? So treat it like it matters, because at the end of the day, that's all that matters, okay? Your own personal safety. Hazardous materials. So on scene, again, we're talking about scene hazards. Ultimate test of discipline when you have a hazardous material, okay? The truth is your instincts, right, is going to be you just want to rush in, okay? You just want to rush in, especially if there's like a patient lying there. But, let me say this loud and clear, man. If there are hazmat signs, okay, that means placards, if there's unknown substances, weird smells, you do not go in, okay? Full stop. You read you read what you can, from a distance. Maybe with your binoculars if you have some in your rig. Maybe just through the windshield. Reference your emergency response guidebook. You should have it in your rig. We're going to go over it at some point during this class. And you call it in, man. You wait, because you are not hazmat trained. Some of you might be hazmat aware certified, hazmat fro certified, but you're not in that capacity, right? Right now you're working in the capacity as an EMT. Okay? You do not have the gear, you don't have the experience, the expertise, really to protect yourselves or your partner in that kind of environment. And once you're exposed, you're not going to help anyone. You just become another patient, okay? So your safety, again, matters the most. So fight the urge to be the hero, slow down, size it up, and don't step in until someone trained and equipped says it's safe for you to do so. Electricity, okay? Now this goes far beyond just the electricity in your wall outlets. I mean like down power lines, damaged poles, storm debris, lightning even. Electricity kills, like quietly, sometimes loudly, but you can't see it, right? Now, if it's a lightning strike, you can see it, or if it's an arc. But for the most part, it's silent. You can't see anything. You can't smell it. It doesn't warn you before it strikes. So one of the biggest mistakes new EMTs make is assuming a power line is dead just because it's not sparking, okay? So don't do that. Always assume any down power line is live. Mark off a danger zone just to make sure everyone's aware that there is a down power line or some form of danger. Use the distance between the poles as a guideline. Do not go near it until utility crews, so out here would be like SoCal Edison, crews confirm it's safe. Okay. Same goes for lightning. It's not a huge issue out here in in the AV, but if your skin starts to tingle, if your hair starts to stand up, you're about to get hit by lightning. So typically, what you want to do, you just want to get as low as you can, drop anything metal, move away from any type of wet areas, ditches, wires, and remember, lightning can strike twice. So yeah. If it does strike the ground current can travel. So yeah, this isn't overkill. This is like how you keep breathing from electricity. Very scary thing. Fire, super unpredictable. Doesn't care about training. It doesn't follow rules. It moves fast. It consumes oxygen. It changes the air and it creates deadly gases that you can't smell or see. Carbon monoxide, cyanide, these aren't just, just words, they're real threats on a fire scene. And the heat, man, you might not think I'm not in the fire, but all it takes is breathing superheated air for 1 second to damage your airway permanently. So if you're not trained, if you don't have the proper turnout gear, you don't have the proper SCBA, you do not enter a burning structure. It doesn't matter if you see someone screaming for help inside, you just let the firefighters know, like, hey, there's someone trapped in there, what you saw, and then you let them handle their job, okay? And also, you don't just quickly lean in to see and just check real quick. Again, you definitely don't want to delay evacuation for gear. So again, fire kills EMS providers who got too close too fast, okay? So be smart, trust your training, wait for the firefighters to call you in, and they're typically going to bring the patient to you, okay? So don't rush into the dangerous environment. Vehicle crashes. Yeah, it's going to be one of the most common and honestly the most underestimated hazards in EMS. You think it's over because the cars have stopped moving, but let me tell you, the scene is still alive, okay? You got leaking fuel, unstable vehicles, broken glass, airbags that haven't deployed yet, traffic flying past you, 60 miles per hour. Before you even get out of the rig, you need to know where to park, how to shield the scene, what gear you're walking into. Typically, you're going to be wearing reflective vests, gloves, boots with traction. Those are like the non-optional things. You stage the scene. You look for power lines. You don't want to move the patient or go inside vehicles until firefighters say that the structure is stable, that the battery's been cut, so there's no chance for airbags to deploy. So crashes, vehicle crashes, they're not just trauma, they're loaded environments with different layers of danger, okay? So the safer you are, the safer your patient will be as well. And now that now, the one that really makes your adrenaline like just absolutely spike is the moment you hear the call type of violence, right? Anything violent related. This could be anything like assaults, domestic disturbances, shootings, riots. They might seem calm when you arrive, but that can change like super fast. People are scared, angry, grieving, and it really just makes them unpredictable, okay? You don't enter any of these types of scenes that you've been dispatched to until law enforcement tells you it is safe, okay? Not probably safe, not I don't see anything. It's like officially cleared, okay? And that's typically gonna be coordinated with your dispatchers and law enforcement and whatnot. So if you ever end up on scene before you get that all clear, you leave that scene and go stage, okay? Because at the end of the day, your life is not worth the risk of trying to sneak into to get the patient, right? And even when you do go in, you need to stay alert. Your eyes are constantly scanning. You're listening. You're checking where your partner is, where the exits are. The worst thing you do is get tunnel vision. So don't get tunnel vision on the patient and miss what's happening around you, okay? Your safety should always be the top priority. Because really you can't save anyone if you get hurt in this entire process. So if we go deeper into violent scenes, we're not just talking about someone like waving a knife, okay? We're talking about the unpredictable, high tension situations. These are the active assaults, domestic abuse, maybe a bystander pulling a weapon. These scenes are layered with risk, okay? Just because law enforcement is there doesn't mean the threat is over. Sometimes it's just starting, right? People are emotional. Crowds are unstable. You might be walking into a living room, right, that looks calm until someone realizes what's really happening and starts to lose control. You have to stay alert. You're not just a medical responder here, you're also a target, okay? So if you're not careful. Always position yourself near an exit, know your surroundings, talk less, and really observe more, okay? And remember, your role is not to intervene in the conflict, okay? It's simply to care for the actual patient after the scene is secured. So don't let your empathy override your judgment. If your gut tells you something is off, just back out and wait for it to be safe, okay? It's really not weakness, it's called wisdom, okay? So now what can you actually do to prevent violence from reaching you, okay? Well, it starts with training, scene awareness, de-escalation techniques, communication that's calm but firm. If you walk into a scene like really hyped up, barking orders, yelling, acting like you're in charge, that immediately will escalate the tension. So people tend to mirror what they see. So you need to be calm in the chaos, all right? Calm in the chaos. You also need good dispatch intel. If a location has a history of violence, you should know that before you go in. And as a crew, you need to talk through the scenarios in advance. What would we do if someone tries to interfere? Where would we move the patient if a crowd forms? This is the kind of preparation that can be the difference between a clean call and a dangerous one. And if violence breaks out, have a plan. Have body armor if your agency provides it. Know your options for escape, and most importantly, speak up if you see warning signs. Because again, your life matters more than the timeline of that transport. So just to be blunt, violence against medical providers, against EMS, it's real. So not just verbal threats, but physical assaults. And it's more common, unfortunately, than we like to admit. The stats honestly are sobering. EMS providers are injured in violent incidents, probably more than 20 times the rate of the general workforce. So we can't pretend it's rare or that it won't happen to you, but really prevention starts with the mindset, okay? You don't ever assume that the scene is safe. You assess constantly. You keep your back to the wall, your partner in view, your gear within reach. And if the scene starts to escalate, you simply leave, right? You don't wait for things to go sideways. Protection also just means knowing your tools, right? Again, body armor in certain circumstances, chemical deterrence if allowed, right? Verbal defense skills, self-defense techniques. Most importantly, that you need a culture that supports reporting, right? If you get threatened, assaulted, or harassed on a call, you simply report it. Not because you can't handle it, but because no EMT should be expected to absorb abuse as a part of the job. Okay, because it's not a part of the job. And the more we speak up, the safer we all become. Okay, because we got to advocate for each other as well. So let's go ahead and shift gears a little bit and talk about our gear. Your uniform itself isn't just like the dress code. Now, don't get me wrong, it is a staple of professionalism. But just like you wouldn't enter a fire without like turnout gear, you shouldn't roll into unknown conditions without the right clothing on. Okay. You need to know what's available, how to use it, and how to inspect it before every shift. Okay, one tear in your coat, one busted zipper, one worn out sole on your boot. Those things can turn a minor risk into a major injury. And don't wait for your agency to tell you it's time to replace your gear. You're the one wearing it. You'll know when it's no longer holding up. So protective gear doesn't just keep blood off your skin. It keeps glass out of your hands, needles out of your legs, the cold out of your bones, and really like the stress off your back, both literally and metaphorically. So use it, respect it, and don't get lazy about it. So if we look at the specifics, we have gloves. That's gonna be like your first line of defense, and not just medical gloves, but you need like heavy duty gloves for rescue operations, for working near like metal, glass, fire, debris. They'll limit your dexterity, like the use of your fingers and whatnot, but the trade-off is protection. Okay, helmets. Anytime you're near falling debris, unstable structures, or even at the vehicle scene with steep slopes or drop-offs, you'll need to wear a helmet. And it's not really a construction hard hat. It's like you need an impact-rated chin strap helmet that stays in place. When you need them, okay, right? And the boots. Boots are going to be standard. Doing a full shift of work, they need to be steel-toed, composite-toed, water resistance, flexible, high enough to protect your ankles. I like the ones with the shank on the bottom as well. They should grip in the snow, in the oil, in blood, on gravel. If your boots can't do that, then you need to replace them. Again, I've seen many EMTs go down from just a bad step on wet stairs, right? It's not about looking tactical. It's about really walking away from every call in just one piece. So we talked about gloves, helmets, boots, but we can't forget about the rest of your body. Again, eye protection, non-negotiable. You need to protect your eyes whenever there's a chance for splatter or debris, right? Single splash of blood, vomit into your eyes can lead to an exposure report, weeks off, weeks of follow-up testing, worse, right? It's not something you want to be a part of. Side shields or full goggles. Again, you don't want to rely on just your normal glasses. Ear protection, especially if you're working outside in on a big traffic collision. Ear protection would be not too bad. Siren, sure. Helicopters are pretty loud tools. This is like something that's going to happen over a long exposure. You're going to start losing your hearing. Sometimes it creeps in, and by the time you notice, it's already permanent. So you always want to kind of keep soft earplugs handy in your kit. Skin protection matters. If you're outside working long shifts, sunscreen. Then there's body armor. Again, this is only if the department issues it. Some don't, most don't. But if you work in high-risk areas, you may need to actually invest in yourself if that's what your department allows. But whether it's required or not, it only works if you wear it, okay? Same with everything else, quite honestly. The best gear in the world won't really protect you if it's not sitting in the rig, right? So if you leave it at the station, if you leave it at home, it's leaving it in your car, it's not doing you any good. So make sure you take it with you every single shift. All right, so caring for critically ill and injured patients. So you're gonna walk into some scenes where fear is like thick in the air, right? You'll see it immediately on the patient's face. You'll hear it in the voice of the family member, and you'll feel it trying to like crawl into your own chest, right? In those moments, the best thing you can do is just introduce yourself, tell the patient, hey, I'm here to help. And even if even if they can't respond, even if they're unconscious, just talk to them. Let them know someone is present. It's just medicine, right? It grounds them, it grounds you, and then as you begin your assessment, your interventions, just keep talking to them. Tell them what you're doing. Tell them what to expect. Tell them more orientation you give, the more you're going to reduce their fear. Okay, that sense of control, even if it's tiny, it really all just matters. It builds trust. Even if they can't speak it back to you, you're not just managing vital signs. You're going to manage their fear and anxiety, and that's almost just as important. Sometimes words can hurt more than help, okay? So be careful of the phrases and words you choose. Saying things like, this looks bad, or we might lose them, doesn't make you seem honest. It increases panic, right? You can be real without being grim. Give information that helps the patient stay grounded, and you should always be honest, but with compassion. You don't make promises you can't keep, but you can say, we're doing everything we can. Okay, that's the truth, and it gives them something to hold on to. Orientation goes beyond just telling them what you're doing, but it also reminds them, hey, where they are, who you are, and what comes next. Okay. That might sound basic, but when someone is disoriented, they're terrified, or in just immense pain, that clarity can stabilize their mental state, and while you stabilize their body. For the family members watching nearby, okay, your calmness becomes kind of a leadership, right? Even if no one says it out loud, okay? So always try to maintain professionalism, calmness, composure, okay? It's going to pay, again, dividends in the end. Children. Can't forget about the children. When a child is critically ill or injured, okay, the emotional stakes go through the roof. For the parents, for you, for everyone on scene. Okay, if it's safe and possible, a parent or caregiver should be with the child during treatment and transport. Okay, their presence typically will calm the child, help you do your job, and really provide emotional support that you cannot replicate, no matter how skilled you are. And when the worst happens, when a child dies, it's a different kind of grief, okay? It's harder, you feel it deeper, you're gonna think of your own kids, your family, the people you care about, and that's just human, okay? So don't fight that feeling, but do your best not to let it consume you either, okay? You still have a role, you still have a job, and that includes helping the family, okay, if they let you. Sometimes it means silence, sometimes it means just being present, and sometimes it means just saying I'm so sorry and meaning every word of it. But so one of the toughest things you're gonna do and see. Segueing into the other hardest part of the job, same hard part, is going to be death. Okay, you're going to see it. You're going to smell it. You'll feel the room shift when it happens. Sometimes it's sudden, a car crash, cardiac arrest. Sometimes it's expected, hospice patient, slow decline. But no matter how it shows up, you're going to carry it with you. And that doesn't mean you're broken. It just means you're human, right? The first time you witness death, you might freeze, you might cry, you might feel nothing at all. And all of those are valid reactions. What matters is how you process it afterwards, okay? Death isn't just about the patient, it's about the people left behind, their grief, their confusion, anger. You'll be a part of those moments too, and how you handle it and handle them, with dignity, professionalism, compassion, it's going to leave a lasting mark. So maybe not one they can name, but they'll remember how you made them feel. Okay, so you're not just responding to a death; you're helping someone begin the grieving process. Okay, and that's one of the most sacred things you can do as a first responder or an EMT. When you respond to a scene, we're going to talk about the stages of grief. When you respond to a scene when someone has died or is dying, you're not just treating a patient, right? You're stepping into a a profoundly human moment. Okay, and what unfolds around you is called grief, right? In 1969, psychiatrist Elizabeth Kubler-Ross described 5 stages of grief that really helps us understand how people may process loss. Okay, and that's typically it goes in progression. Okay, starts with denial, anger, bargaining, depression, and then finally acceptance. Okay. But be clear, people don't follow these stages like a simple checklist, right? They may bounce between them, skip some, stay in one longer than the other. Denial can sound like this can't be happening. Anger might actually most of the time come at you like, why couldn't you do more? Like, what took you so long? If it's really unfortunate. Bargaining, like if only phases, like if only I took better care of them. If only we went to the hospital sooner. Depression brings the heavy silence, right? And acceptance is when it comes, and it's often when it comes. Acceptance, it's quiet. As an EMT, your job again isn't to diagnose grief. It's simply to recognize it, respect it, and not make it worse. Okay, you are one of the first people they'll encounter after their world just completely changed. So the way you respond, not just what you say, but like how you say it, it's going to matter like more than like you may ever know. So what's your role? So when people are grieving, they need space. They also need permission, right? Permission to cry, to rage, to simply fall apart. It's not unprofessional behavior on their part. It's just, again, a human response. Okay, it's a human response to an unimaginable loss, and sometimes you'll be the one who helps them feel that it's okay to feel, right? Try to avoid cliches. Don't try to fix it. Simply saying, "I'm so sorry for your loss." It's powerful, right? It's honest. It doesn't try to minimize or explain. Also know that some people may not cry at all, right? They may go completely quiet, expressionless, numb, right? That is grief too. And you might feel the loss also. Like you might think of your own kids, your own family, and that feeling reminds you of the weight of this work that you're doing. But the important thing is you don't let it paralyze you, right? You're still there to help, to guide the next steps, like helping the family understand what happens next, connecting them with resources, or just giving them a moment to sit with their pain in just peace. Now, let's talk about when the patient is a child, right? This is where your textbook and real life both hit differently, okay? Society doesn't expect children to die, right? It's unnatural, right? It feels unnatural. It feels unfair and unbearable. So when you walk into the kind of call, and everyone in the room, including you, is carrying a heavier emotional load. If the family wants to see or hold the child, and if it's safe and appropriate, you allow that, right? You explain what they'll see. You give them space. This might be the part of their healing process, but unfortunately, if the death is part of a crime scene, or if the injuries to the child are like especially traumatic, you have to use your judgment. Okay, some situations call for waiting until additional support, like clergy, law enforcement, or a counselor is present. Your goal is to not shield them from reality. Okay, it's to help them face it without being alone. And remember, this is going to affect you too. The textbook here is clear. The death of a child creates deeper, longer-lasting stress in providers. So don't try to be a hero by carrying it alone. You need to talk to someone, right? You need to have a debrief, right? Process. You're still human too, and that humanity is really what makes you good at this job. So stress, right? That's what we're talking about. So stress doesn't just show up after like the bad calls we just talked about, right? It lives in the daily grind. Okay, shift work, right? Missed meals, sleepless nights, emotional overload. The body's response, the body responds to stress in different stages, alarm, resistance, and if there's no relief, just pure exhaustion. Okay, this is called general adaptation syndrome, and it's the same process whether the stress is physical, emotional, environmental. In the alarm stage, your nervous system floods with adrenaline, your heart pounds, your breathing speeds up, your muscles tense. That response might help you in a crisis, but if it stays activated for too long, it will wear you down. Okay. The effects become physical, headaches, digestive issues, insomnia, might show up in emotional, like an emotional state like anxiety, irritability, depression, and professional, just reduced performance, errors in judgment, disengagement from work. Knowing how this system works means you can catch it early. It's not weakness to admit you're stressed. It's just physiology. Ignoring it won't make it go away. It'll just make it worse. Okay. And in EMS, that can be dangerous for you and your patient, unfortunately. So what do? You start by building habits before the stress just breaks you. That means good sleep, regular physical activity, healthy diet, and downtime. You need outlets that have nothing to do with EMS. You need hobbies, time with friends, creative pursuits, anything that really reminds you that you're more than just the uniform. You also need to recognize that the signs of cumulative stress, right? Irritability, fatigue, loss of joy, withdrawal, reliance on alcohol or other substances. These are warning lights on your dashboard, okay? Don't ignore them, and if the stress does get too big, if a call haunts you, if your behavior starts to shift, you reach out. Your textbook talks a great deal about critical incident stress debriefing, right? Peer support, counseling. Use them. It's important for EMS culture to normalize them, okay? Because the people who last in this field aren't the ones who bury everything deep down, right? They're the ones who ask for help and keep showing up. So that's really the strength. That's the resilience, if you will. And that's how you survive in this work for the long term, okay? Some situations just honestly hit differently. You'll know when they come, unfortunately. An infant code, the fatal crash, the fire scene with screaming family members. But what the textbook makes clear and what experiences confirm is that stress doesn't always wait for those big, obvious moments, okay? It can come from repetition, from the seemingly minor calls that just pile up, from the toddler with bruises that you just can't unsee, from the car wreck where you recognize, the high school sticker on the bumper or something like that. The stress lives in the small things too, okay? So the nonstop calls, the overtime, the shifts where you didn't sleep, you didn't eat, you and your partner in bad moods. It just lives in silence after a patient dies and nobody says anything. So you don't always know when it's going to strike, and you won't always feel it right away, but you have to know that it is there, it's just accumulating and waiting, right? So you prepare for it, but not by pretending it won't happen, but by recognizing that when it does, your reaction is human. It's not weakness, it's not failure, it's just really honestly human. Different patients will react to stress in different ways, okay? And you will too. Some people scream, others go just silence. Some try to take control, others shut down. No one is wrong, okay? What matters is that you recognize these reactions, right, for what they are. They're just normal responses to just abnormal situations. A patient might panic because they've been through something similar before. A family member might lash out because they're just terrified. You might feel numb after a call that you should have wrecked you, and then feel wrecked by the next call that seems routine, right? That's all part of the job's emotional terrain, okay? Your textbook gives a list of factors that can influence how people respond to crisis. Things like age, cultural background, mental history, substance use, and more, right? The list goes on. But the takeaway from all that is just don't assume, don't judge, okay? Your job isn't to correct emotion, it's to stabilize when it it's needed, and to respect it always. Okay, and that's including your own. So how does your body react to stress? So let's break that down. So you've probably heard of the fight or flight response, but in the field, there's often no running away. Okay, so your body fights. Okay, you get that adrenaline dump. Your heart increases, faster breathing, tightened muscles, sweaty palms. And that's really the alarm phase. Okay, your body is saying, "Hey, something's happening." It's be ready. All right, and in the short term, it does help. Okay, you're sharper, quicker, you're more focused, but your body can't stay in that mode forever. Okay, if it doesn't get a chance to just like reset, you're going to slip into the next phase, and that's going to be the resistance. Your body tries to function despite being under pressure. You're probably not going to notice it right away, but But now that you're skipping meals, you're losing sleep, you're snapping at people you care about, and if you keep going without support, without rest, without an outlet, you hit that final phase. Okay, and that's going to be exhaustion. Okay. That's where the breakdown happens. That's where long-term damage sets in. Recognizing this cycle is the key to stopping it before it completely takes over. These stress reactions show up different timelines. Okay, you have what we call acute stress. Okay, so that's going to hit you during the actual event. So your heart's racing, tunnel vision. You may freeze up or become hyper focused. You might perform well, but feel the aftermath later. Okay, then you have delayed stress. Okay, that shows up after the fact, days later. You can't sleep. You keep replaying the call in your head. It hits like a wave when you thought you were fine. And then there's cumulative stress, okay? And that's the one most dangerous, okay? It builds up over weeks, months, years, from every tough call you didn't talk about, from every shift you worked without rest, every time you said, "Hey, I'm fine," when you weren't, okay? This is the stress that breaks people, that leads to burnout, that really drives people out of EMS or worse. Okay, but the good news is that it's also the most preventable. Okay, if you recognize it early, if you deal with it consistently, you stop treating it like a personal flaw and start treating it like just an occupational hazard that it is. So, how do these stress reactions actually show up in real life? Your textbook gives you, a list, and I promise you'll recognize some of this in yourself or your coworkers. Fatigue, headaches, trouble sleeping, short temper, lack of appetite, and for some, overeating. Difficulty concentrating, withdrawal from social interactions, losing interest in the job, or worse, showing up but not caring. So these aren't isolated issues. They're just warning signs. Okay, they're the body and the mind throwing up flares, so to speak, and say, "Hey, something's not right. So, something's wrong." And if they go unchecked, they can evolve into clinical depression, anxiety disorders, or even physical illness. So when you see these things, when you see these signs, whether it's in your mirror or across the bench seat in the rig, you don't ignore them. You need to acknowledge them, and then you do something, right? You talk, you rest, you reset. Okay, the job is stressful. That's never going to change. But how you respond to that stress, okay, that's where your power actually lies. So let's put a bow on this idea of stress reactions. Okay, the important thing to remember is that these responses they aren't random. Okay, they're predictable. They follow a pattern, and once you know what to look for, you can interrupt that pattern before it becomes something worse. Okay. The real challenge in EMS is that we normalize stress. We treat sleepless nights, skip meals, mental overload, as the cost of just doing business. Okay, and in some ways they are, but they shouldn't be constant. Stress will happen. It's not failure. It's just it's just biology reacting to the high demands. But if you feel yourself carrying that stress with you after the call is over, if you bring it into your home, your relationships, your health, that's when it's time to act, okay? So the earlier you recognize the signs, the easier it is to recover. Don't wait for that stress to become trauma, okay? Catch it while it's still manageable. And that's how you stay, again, that's how you're gonna stay in this field for a long time. and be healthy and well inside of it. But now, what happens when stress gets deeper, right? When the call doesn't just bother you, but stays with you, okay? That's when we are going to enter the territory of post-traumatic stress disorder, or PTSD, okay? This isn't about being like too sensitive or you're just not cut out for the job. It's about your brain holding on to an event in a way that just keeps looping, okay? You keep reliving it, reacting to it long after the danger is gone. So you might avoid things that remind you of the call. You might have flashbacks or nightmares. And it's not always the big dramatic incidents that cause it. Sometimes it's a quiet moment. It's a kid who looked like your nephew, a patient whose last words just echoed something you weren't ready to hear. The point is, PTSD can happen. It can happen to anybody. So the solution isn't to push through it, it's to actually get help and get help early, because this one is not going to get better on its own. So what can we actually do about it? This is where the whole critical incident stress management or debriefing comes into play, the CISM. It's not a fix-all, it's not a magic fix, but it is a structured way to decompress after a traumatic call. Okay, there are different parts to it. Diffusing sessions right after the incident, and more formal debriefings the following days, right? These sessions are not about critiquing your performance. They're really about processing what happened, to get it out, hearing that you're not alone. And maybe learning a few coping tools from people who've been through similar things. But it's not a one-size-fits-all. The CISM helps many providers, but not everyone connects with it, right? That's okay. Peer support, employee assistance programs, counseling, those are all valid paths. The point is that there is a path, so you don't have to carry this stuff forever. You don't get a medal for suffering in silence. You just get burnt out, or worse, So you owe it to yourself and your patients to be whole, to be healthy, and to ask for help when you need it. Burnout. Burnout is something I've experienced myself, and it doesn't come all at once, right? It sneaks in there. It's a little fatigue here, a little cynicism there. Maybe you stop caring about certain calls. Maybe you start making dark jokes just to survive the shift. That's just not personality. It's really a warning sign. Okay, so burnout is far more than just being tired. It's like a slow erosion of your empathy, of your motivation and purpose. So you showed up, but you're not present. You go through the motions, but you're not connected to the work anymore. And it affects really everything. Your patient care, your teamwork, your personal life. Your textbook, it ties burnout to longer hours, high call volumes, too much paperwork, and really just not enough support, right? Not enough support is the biggest one. But at its core, burnout is simply depletion. You're giving more than you're refilling, and eventually there's nothing left to give. So preventing burnout isn't about taking a vacation once a year. It's about building boundaries into your routine, protecting your time, reinvesting in what makes you want to come back to that next shift. Then there's like compassion fatigue, okay? And this one's different. It's not about being overworked. It's about being overexposed to pain, right? Overexposed to emotion. This is what happens when you care so much for so long that your ability to actually feel it kind of starts to numb. It's called the cost of caring. And it hits people who take this job seriously. You start out with big hearts, and that heart just keeps taking hits. Child abuse, overdoses, grief-stricken families, terminal patients. You just absorb it all, and eventually your system, says, that's enough. And the result, unfortunately, is that you lose your ability to connect. You kind of go cold. You stop seeing patients as people. You stop feeling, and not because you're cruel, but because you're just drained. compassion fatigue can lead to poor performance, strained relationships, and even the career-ending burnout. So again, awareness is everything. When you notice that you're getting numb to it all, that's your patience, and that your patience is thinning, that your empathy is running dry. That's the red flag. Okay, so that's the time to refill before the work turns you into someone you just don't recognize anymore. This is the hardest one. So this is a hard conversation, because honestly, the numbers, they don't lie. EMS providers are at an increased risk of suicide. So not just thoughts, not just burnout, but actual suicide. Firefighters, paramedics, EMTs, many are more likely to die by suicide than in the line of duty. And honestly, that should stop all of us in our tracks. And it's not because we're weak. It's not because we're broken. It's because we carry pain that most people can't even imagine, right? And we carry it so quietly. We don't want to burden others. We don't want to look soft. We don't want to be that guy who needs help. But the truth is, strength isn't about holding it in. It's really about speaking up. The textbook mentions national hotlines, peer programs, mental health resources, that are specifically designed for responders. They exist because you are not alone. And because staying silent is just so dangerous. If you or someone you work with starts showing signs, withdrawal, hopelessness, it's talk of better off being gone. You need to take it seriously. You need to ask, you need to intervene, you need to follow up, because this job isn't just about saving strangers, right? Sometimes it's about saving yourself and saving each other. So the emotional aspects of this job, of emergency care, it isn't just about anatomy and skills. It's about emotion. Your patient is scared. The family is panicking, and you're in the middle of it, right? You're expected to stay calm. You're expected to be clear-headed and focused. So that doesn't mean you don't feel. It means you learn how to manage your emotions, without shutting them off. So your textbook talks about recognizing normal feelings, fear, sadness, anger, and not letting them dictate your actions. So some scenes will rattle you. You'll see things you can't unsee, and that's part of the job. But the professional response isn't pretending to be a robot. It's acknowledging your reactions, processing them after the call, and still doing what needs to be done in the moment. So. And honestly, that takes training. That takes awareness, and it takes commitment to your own emotional health, so you don't overreact, you don't freeze, and you don't withdraw. When someone needs you the most. So this slide brings us back. Okay, so the cumulative load of what we do. Okay, so again, it's not just the big mass casualty incident or the cardiac arrest that gets you, right? Sometimes it's the frequent flyer who reminds you of your brother, the overdose in the park, the infant in distress, the domestic violence victim who clutches your hand but won't make eye contact. These are the moments that live in your muscle memory long after the report is done. The textbook highlights things like MCIs, vehicle crashes, fires, child trauma, and yeah, those are all high stress. But so is watching a patient just give up. So is being screamed at by someone who doesn't know where else to place their grief. And the most important thing you can do in these moments, stay professional, right? Say less, do more. You need to stay calm, even when your hands are shaking. You bring order to chaos, and your presence is part of the medicine. Now let's step into the station now, okay? Because even though the field is where you see the action, your workplace environment plays a huge role in your health and longevity. One of the first issues that we face is the cultural diversity. Okay, EMS is changing. We are seeing that what we are seeing and we need to see is a broader range of providers from different races, religions, genders, identities, and experiences. But inclusion doesn't happen by accident. You have to make space for it. You have to confront your own biases, and that means being mindful about how you speak, how you listen, and how you treat people who aren't like you. because EMS, like I said in the beginning, is a team sport, man. If you're undermining a teammate based on their background, you're really weakening the whole crew. Okay, your textbook emphasizes the need for cultural humility. Okay, not just awareness, but a willingness to stay open, to stay teachable, to adapt. That mindset makes you not only a better teammate, but a better provider for the patient who looks nothing like you and still trust you with their lives. Now let's get real with sexual harassment. Okay, it's still unfortunately an issue in EMS. Maybe not in every station, but it is there. It can be subtle, off-color jokes, comments that cross the line, suggestive behavior, and it's just brushed off as just messing around. Or it can be overt, unwanted advances, threats tied to promotions or scheduling. It's clear, any unwanted sexual behavior that creates a hostile or uncomfortable work environment, that is harassment. And the truth is, it doesn't matter what the harasser meant, right? What matters is how it was perceived, and the impact it had. If you experience it, you report it, you document it, you protect yourself, okay? If you see it happening, don't be silent, don't laugh along, don't pretend it's not your problem, because we depend on each other in this job. If someone feels unsafe at work, how can they stay focused on patient care? So respect really isn't optional in this field. It's the foundation of trust. And that trust starts at home, in the rig, in the day room, how we treat each other every single day. And another one, let's talk about something else that doesn't get enough attention, the substance use in EMS. It's uncomfortable, but it's real. The stress of the job, the long hours, the emotional overload, all of it creates the perfect storm for misuse. And that might look like alcohol use creeping up after shifts, or maybe it's relying on prescription meds to get through. And in some tragic cases, it's providers using illicit substances just to feel something again. This isn't about judgment; it's about prevention, right? It's clear, like impaired providers put themselves, their partners, and their patients at risk. If you notice a change in behavior, in mood swings, missed shifts, poor hygiene, you need to say something. Report it through the proper channels. It's not betrayal. You're just trying to protect your partner. And if it's you struggling, you're also not alone. Many departments have employee assistance programs. There's help, but you have to take that first step. The bravest thing you can do is admit when the job is affecting you, more than you can manage, on your own. And then let's finish up with workplace issues with a focus on what we're all trying to create, and that's a culture of safety, of respect, of just mutual support. That means calling out inappropriate behavior, reinforcing good behavior. It means giving new employees space to ask questions. It means checking on your partner after a bad call. It means not letting the old school, suck it up mentality stop you or others from speaking up. And, it means being honest about your own limits. If the job is affecting your health, your family, your happiness, again, that's not weakness. That's a signal that something needs to change, okay? You can't give good patient care if your foundation is crumbling. Culture starts with just a conversation. So if you want a better team, a safer crew, a healthier workplace, be the person who helps build it. It's really just one respectful interaction at a time. All right, team, and that is the end of chapter 2. We will see you next time.